Welcome to Community Health Workers Working in Diverse Settings, the Hawaii Exemplar. My name is Merlene Tucker, and I'll be running today's web forum along with my colleague, Jeff Bornstein. Today's web forum is sponsored by Workforce Pathways for the Public's Health, a program of PHI Center for Health, Leadership, and Impact, and produced by Dialogue for Health. The moderator of today's event, Dr. Carmen Rita Nevadas. Carmen is a senior advisor at the PHI Center for Health, Leadership, and Impact, founder of Dialogue for Health, and senior vice president emeritus of external relations and preventive medicine at the Public Health Institute. Welcome, Carmen.
Welcome, everybody, and thank you so much, Marlene. We're really happy to have you all here with us today. I'd like to begin with a brief overview of the PHI Center for Health Leadership and Impact and the Public Health Infrastructure Grant. CHLI's mission is to advance health and equity by increasing the capacity of individuals and teams to transcend boundaries, work collaboratively, and transform their communities. Our programs help teams and individuals to build healthy, more equitable communities by developing multi-sector partnerships and leveraging local resources. Next slide. The Public Health Infrastructure Grant is a groundbreaking federal investment in the U.S. public health system that ensures every U.S. community has the people, services, and systems needed to protect and promote health. Through three national partners, National Network of Public Health Institutes, the Public Health Accreditation Board, and the Association of State and Territorial Health Officials, government health departments have access to training and technical assistance to address their infrastructure needs within their departments. CHLI is very proud to serve as a key partner for HHS Region 9 public health departments across California, Arizona, Nevada, Hawaii, and the U.S. Pacific Islands through NNPHI. In this capacity, we support training and technical assistance needs around workforce and their departmental foundational capabilities to address long-standing public health infrastructure needs. Next slide, please. We have an informative presentation for you today on a topic of high interest nationally, community health workers. Today, we will focus on CHWs in diverse settings, the Hawaii Exemplar. Objectives for this afternoon include learning about the history, foundation, and framework of the Hawaii Community Health Worker Association. We want you to gain a deeper understanding of CHWs and the effectiveness of the work they do to deepen trust and understanding within their community. And we also want you to learn more about the critical role that CHWs play establishing communication between patients and providers. I would like to start by introducing our panelists. This is a really great group. And let me start with Gracie Flores, who was born and raised in Hilo on the island of Hawaii. She's worked as a community health worker with United Healthcare since 2015 and has over 15 years of experience in the human services field. Gracie served as the first vice chair of Hawaii Community Health Worker Association and is now the current chair. Gracie is also the vice president of Malama Ka'aina Hana Ka'aina King's Landing Community Association, a member of the East Hawaii Coalition to Prevent Child Abuse and Neglect, and a member of the National Association for Community Health Workers. Gracie has a passion for improving the health of our communities and advocating for community health workers in the state of Hawaii. Next slide. So she'll be followed by Chauncey Hatiko, who is a native Hawaiian community health worker who is well-rooted in his community, as you'll soon hear. He joined the Hawai'i Public Health Institute in November of 2023 as the Hawaii Community Health Worker Association coordinator to support CHWs across Hawaii. Before joining the Hawaii Public Health Institute, Chauncey worked as a CHW at Hawaii Medical Services Care Association in care coordination as a CHW supervisor at Hui Me Iama Ulane Oiwi as a certified medical assistant at Queens North Hawaii Community Hospital. He has a CHW certificate of competence from Maui Community College and is a certified clinical medical assistant through the National Health Career Association. Chauncey has recently been selected by the National Association of Community Health Workers as a subject matter expert on Native Hawaiians and Pacific Islanders. Chauncey is also a musician, a kalo farmer, owner of Ku'ui Ohana Farm, and vice president of the Waipio Valley Taro Farmers Association. In his spare time, he enjoys time with his wife and 3 sons, playing Hawaiian music, dancing hula, and sharing his culture. Chauncey believes that CHWs are vital in bringing health equity to Hawaii. Next slide, please. Our next speaker is Rosalind Philemoni. Rosie was born and raised in Ke'au in the district of Puna on Hawaii Island. Since starting her career, she has worked with rural communities throughout the island of Hawaii in partnership with many community health workers to develop health events based on each community's needs. Rosie is now a community health worker liaison with the Hawai'i Public Health Institute, where she continues to grow and work alongside CHWs, strengthening the CHW workforce so they can continue serving their communities. This is an incredible panel, and I really look forward to hearing from each of them. So, Gracie, I think you have the floor. Go ahead and take it away.
Mahalo, Carmen, and thank you so much for having us. Aloha, everyone. My name is Gracie Flores, and I am a community health worker. I'm super excited to be here today alongside Chauncey and Rosie to share with you the important work of our CHWs in Hawaii, as well as the initiatives we've been moving forward for the CHW workforce. Please advance the next slide. So for those of you who are on the call who don't know what a CHW is, well, I'm happy to share with you who we are and what we do. And I'm glad to see that there's a lot of people that want to learn more about CHWs. Next slide, please. So according to the American Public Health Association, community health workers, or CHWs, are frontline public health workers who are trusted members of the community who have close understanding of the community served. This trusted relationship enables CHWs to serve as a liaison, or link between health and social services and the community to facilitate access to services and improve the quality and cultural competence of service delivery. CHWs also build individual and community capacity by increasing health knowledge and self-sufficiency through a range of activities, such as outreach, community education, informal counseling, social services, and advocacy. Next slide, please. Community health workers have various titles depending on their specific roles and responsibilities. You can find some CHWs working for our health departments, federal qualified health centers, hospitals, and community-based organizations. Some common titles for CHWs include outreach workers, case manager, health educator, patient navigators, and other titles you see listed here. Next slide, please. CHWs build relationships and trust by addressing social determinants of health. Some factors that are unique to Hawaii are historical trauma, limited access to care, environmental factors or natural disasters, poverty, the high cost of living, and also cultural barriers. Next slide, please. During COVID-19 and the recent Maui fires really put CHWs on the map. CHWs were identified as part of an interdisciplinary team and recognized as crucial partners to building community resilience. CHWs responded to COVID-19 and assisted with treatment referrals and contact tracing, health education, needs assessments, and translation. CHWs were the boots on the ground responding to the Maui fires, providing navigation to social services, behavioral health providers, informal counseling, outreach services, and engagement. Community health workers continue to implement their skill sets to build community resilience in Hawaii. Next slide, please. So these are some of the CHW core competencies that CHWs are trained on in Hawaii. Some key skills that CHWs possess are outreach skills, capacity building, navigation skills, service coordination, and advocacy. Next slide, please. So currently, there is no certification or licensing requirement for CHWs in Hawaii. However, there is a CHW course through the Hawai'i Community College systems that is provided statewide. Some include Kapulani Community College and Maui Community College. We are also hoping they will bring the course to the Big Island, where I live, to Hawai'i Community College. Additional trainings are offered through the Hawai'i CHW Association, Lunch and Learns, that is developed by CHWs for CHWs. But most importantly, it's their lived experience that makes our CHW workforce so impactful, because it's something that you can't teach or learn in a classroom setting. Next slide, please. So now that you know what a community health worker is, I want to share a little bit about myself and a short story about where I come from. I was born and raised in Hilo, Hawaii, which is the same community that I serve and where I raised my family. Some of my fond memories growing up as a child was visiting my grandfather's home, a place called King's Landing on the Big Island of Hawaii, which is also the picture of my background behind me. It's a very remote area with no running water or electricity. You need a truck to access its roads due to its rugged terrain. It is a place I identified as home and where I learned how to swim in its freshwater ponds as a child. I even got married there to my husband 15 years ago in that very spot. So during my younger years, my grandfather taught us how to grow our own food on the aina, or the land, and catch our fish from the kai, or the ocean. But as my grandfather got older, he was no longer able to tend to his crops or gather fish from the ocean. So he depended on his ohana, or his family, us, to make sure he had food, clean drinking water, supplies, and gas for his generator that ran his television and his antenna. That was one of the most important things to my grandfather, so that he could watch his 60 Minutes every Sunday night. My time I spent caring for my grandfather was one of my first experiences with community health work. And like I said before, it's that lived experience that really makes CHW work so unique and impactful and effective. Today, I continue to work with members just like my grandfather, providing outreach and support to individuals in remote areas where services and resources are limited. In 2015, I had the privilege of being the first CHW in Hawaii hired by a Medicaid health plan. My experience as a CHW has been very fulfilling and has allowed me to grow in many ways professionally. This slide has a few photos of myself with members of my team and other community partners at various community events in my hometown. We organized a slipper drive for clients living at the Care Hawaii shelter. We provided resources for families during the Hawaii Island Food Bank distribution during COVID, and also participated in various COVID vaccine clinics. We took time to sign wave during United Nations World Day to bring awareness to human trafficking in our community. Also on this slide is the Mayor's Proclamation event to honor Child Abuse and Awareness Month, and also the Hawaii Island Alzheimer's Walk. Next slide, please. Today, our Hawaii plan employs 15 CHWs that provide support to our members on 6 islands throughout the state. Our CHWs work in many different capacities and departments, touching members of all ages and diverse communities. They outreach and provide support to our members enrolled in our special healthcare need programs, our Hapai Malama program, which is our postpartum and prenatal members, early and periodic screening, diagnosis and treatment, or EPSDT, which are our pediatric members, health risk assessment referrals, which are newly enrolled members that are screened and identified for any needs for support. Our hotspotting, or persistent superutilizers, which is our high cost members, and also our disease management program for our members diagnosed with asthma, diabetes, and obesity. Our community integration services, or CSI, are services for members experiencing homelessness and diagnosed with a chronic health condition or mental health condition. And finally, our Community Transition Justice Involved program for members that are involved in our justice system. Next slide, please. So now I'm going to talk about the impacts and benefits of the CHWs while CHWs are being employed by health plans. And so why should health plans or any other managed care organizations hire CHWs? Because CHWs improve health outcomes by providing health education and promoting disease prevention and management. They increase access to care by outreaching to remote and underserved populations where traditional healthcare systems may not be able to reach. They help to reduce healthcare costs by preventing hospitalizations and emergency room visits. CHWs maintain member engagement that increases member satisfaction, which in turn promotes membership retention for the health plan. CHWs address social determinants of health by leveraging community resources that health plans may not be able to offer under the health plan benefits. Community health workers are community resource experts and collaborate with community partners to ensure the best care for their members, overall reducing health disparities, especially for our Native and Pacific Islander communities, which have the highest rates of chronic illness compared to the general US population. So having community health workers integrated into a clinical team have lots of benefits. It enhances patient engagement because CHWs tend to serve in communities from which they come from. That fosters trust to encourage their patients to engage in health services. CHWs are culturally competent. They often share similar cultural backgrounds to their patients, and they possess the cultural knowledge and history of the community they serve. They bridge the gap between patients and clinical providers, and they improve patient communication and understanding, leading to better adherence to treatment. They play a big role in creating equitable healthcare to our vulnerable populations and marginalized communities, ensuring individuals receive the care and respect they deserve. Community health workers are the voice of their community. They are policy advocates that support efforts for systemic change within our healthcare system. So the last thing I want to share, but is not included on this slide, but I feel is important to point out, is that being a CHW as part of a clinical team isn't always picture perfect. We do experience challenges such as not having clear role definitions between other healthcare professionals within our team. There may be a lack of standardized training for CHWs, forcing them to follow learning material that might be geared towards other licensed professionals. Some CHWs may not be earning an equitable salary compared to other healthcare professionals, even if they're doing similar work and reducing healthcare costs for the health plan. So because of those challenges, it made me want to connect with other CHWs. And I was fortunate to find a CHW group several years ago that eventually formalized into the Hawai'i Community Health Workers Association, where I serve as chair. And we'll be sharing more about our association later on in our presentation. But first, I want to pass it on to Chauncey to share about his experience as a CHW in the Hawaiian healthcare system. Chauncey?
Thank you so much, Gracie. It's truly amazing to hear how different organizations such as health insurance, fairly qualified health centers, and community-based organizations are utilizing CHWs to improve patient outcome, really drive down the cost of healthcare overall. You can go ahead and change the slide, please. Now, I know when you all think of Hawaii, you're probably thinking of waterfalls and beaches and birds chirping and waves crashing. But as Gracie has mentioned, although that we live in paradise, the people of Hawaii face many different challenges, especially our Native Native Hawaiian population. Some of the challenges that Gracie had mentioned was our historical trauma. With the Native Hawaiian population, there was a lot of historical trauma that occurred, including the illegal overthrow of our Hawaiian monarchy, the separation of our land, and our cultural practices. Because of this, they caused a mistrust within the Western systems for Native Hawaiians, including the healthcare systems that are here in Hawaii. Another Hawaii challenge is limited access to healthcare. A lot of our people of Hawaii have to fly into neighbor islands such as Oahu just to see their specialists. And the retention here in Hawaii for providers are very low. So we have a very high rate of lack of providers here in Hawaii. And also environmental factors that Gracie had mentioned, such as these rural communities with no electricity, no running water, right? A lot of these people require CPAP machines, right? Or a refrigerator to store their insulin. And these all cause barriers for our people here in Hawaii. And also with our volcano, right? That displaced many people back in 2018 and provided poor air quality for our populations. Very difficult. And also coming from a low socioeconomic status, we see a lot of poverty here. And Hawaii is the highest cost of living within the nation, and poor health literacy due to the low socioeconomic status, and our people really not being able to advance their career and education. And of course, we see these cultural barriers where Native Hawaiians now have this stigma that, oh, we're stupid people. We shouldn't ask questions when we go to the doctor's office. And we also are raised not to share our problems, that those problems are really personal issues that you should really keep to yourself. So a lot of our Native Hawaiian populations have a very difficult time in their provider's office just discussing their lightheadedness or their dizziness or some of these palpitations that are occurring, and have very hard time describing their symptoms due to these cultural barriers that really affect our health outcomes. As Gracie had mentioned, Native Hawaiians have the highest incidence of diabetes, hypertension, and chronic kidney disease. Because of this, the Native Hawaiian healthcare systems were established, and I had the privilege working for a Native Hawaiian healthcare system here in Hawaii Island. The Native Hawaiian healthcare systems were funded by the Native Hawaiian Healthcare Act of 1988, and our target population are Native Hawaiians. So Hui Malama Olana Oiwi had blessed me with the opportunity to become a CHW. Prior to this, I worked for a hospital setting in a clinic in ambulatory services as a clinical medical assistant. For 8 years, never heard of what a community health worker was. I found that quite strange. But of course, being a small community member myself, I automatically gravitated towards these people that really need help navigating this very complex system. After dabbling within the clinical field, I became a patient advocate and really wanted to do a bigger change within my community. And that's where I found the Native Hawaiian healthcare system, Hui Malama Ola Na Oiwi, that really believed in CHWs and utilized them from the very beginning. When I joined this organization, I was partnered with seasoned CHWs that really mentored me. We call these seasoned CHWs the super aunties and uncles of our communities that really started the CHW efforts just going door to door in these very rural communities that were targeted with high Native Hawaiian populations, establishing relationships, asking how their day was going, if there were any needs. And that's really what the community health workers did back in the days, is establish those trusting relationships in already a very untrusting community. Some of the pictures that you see here and some of the support that they actually provided me with an environment for me to grow within the CHW workforce. And that is very important with growing the capacity, is making sure that these employers understand how to support their community health workers. And support they did for sure. They sent me off to college, to Maui Community College, and I received my certificate of competence. They even sent me over to receive CHW supervisor training. And I eventually became the supervisor of our CHW department, overseeing CHW strategically stationed in each district of Hawaii Island. I had a CHW in Ka'u, Puna, Hilo, Kona, Kohala, and Hamakua. And through these community health workers, we're able to engage with our communities. Some of the pictures that you see here is some of the projects that we've done during COVID-19. According to Native Hawaiian Health, they look at the triad: physical health, mental health, and spiritual health. So we dispersed some care packages under our Malama Keola distribution program. We're able to go into these communities with community leaders and actually build this relationship through just this distribution. While we were distributing, we also addressed some needs and were able to connect them to different services. And of course, partnering and collaboration, not one organization can do it themselves. So we understand that it really takes collaboration and networking in order to blanket your communities and build resilience. So we partnered with many federally qualified health centers, as you see here, and we helped them with their COVID vaccines. We helped them with their contact tracings. We also just went down there to partner with them and table and provide services such as health screenings. But we made sure that we strategically partnered with even our legislators. In the picture there, you see Kai Kahele, one of our senators. And then we also helped by promoting a lot of health information. But key to that was actually utilizing community leaders to make sure that we have a familiar face within the community that can get us introduced. And then once we had our foot in the door, the magic started to happen. You can go ahead and advance the slides. So I'll talk a little bit more about the services within the Native Hawaiian healthcare systems. So some of our responsibilities for our community health workers, and a big portion of it was engagement and outreach. We're responsible of doing the intake and registrations which required a health assessment. We're also there at community events. Each community event, we made sure that we were there. Through COVID outreach, we're able to engage our communities as well, and then collaborating and networking with partners. And not just that, once we intook them, we made sure there were constant follow-up visits. Although they may have not been comfortable to let us know about their diabetes, and maybe they were just receiving a package, through engagement, through follow-up visits, and through building that trusting relationship, we're able to have open conversations and really identify their social determinants of health. Not just their diagnosis, but the barriers of why they're not addressing their diagnosis and receiving the care that they need. Through those follow-up engagements, we learned more about their health status, right? Their nutrition, their diabetes if they had, hypertension, and we're able to offer them health education programs that the system offered. We offered nutrition classes and support groups, as well as diabetes classes, as well as hypertension, and as well as a healthy Hawai'i pregnancy program. But it really sometimes took years, sometimes months, sometimes weeks for them to feel comfortable enough as a Native Hawaiian to come out and say, I'm struggling with my diabetes. And these are the reasons why. But we noticed that once we followed up with them and addressed their social determinants of health, they were more open and engaged to addressing their diabetes once their financial status was taken care of, right? Once they figured out their transportation, how to get their families to the bank, to the post office, to their doctor's visits, right? But it wasn't until these burdens were lifted off of them that they could truly understand, what was needed to address their health. And part of the Native Hawaiian culture is really taking care of others before you take care of yourself. So that was a big hurdle that we had to help jump over. You can go ahead and switch the slide, please. Other things that we provided through the Native Hawaiian healthcare system was traditional Hawaiian healing. Now, these are healing techniques that are really banded with our culture. Some of these traditional healing techniques were la'au lapa'au, using native Hawaiian plants for treatments, as well as lomi lomi, a traditional massage practice of Native Hawaiians, and ho'oponopono, the art of making things right. And then we also offered a grow your own la'au, which allowed participants to learn about these plants, learn how to cultivate it, and then learn how to use it for medication, as well as for food sources. And also remember that each family back in the old days had a practitioner, but due to the abolishment of our culture, a lot of these practices were lost. So part of our goal was to raise awareness around these traditional Hawaiian healing practices and bring out more practitioners so that we could offer these services through Hui Malama Olana'o'iwi. You can go ahead and advance the slide here. So CHWs have existed here in Hawaii for a very, very long time, working in different employers as well as in different capacities. But there was a need, like Gracie had mentioned, to unite CHWs to address pertinent concerns regarding our profession, such as certification and CHW sustainability. That is why the Hawaii Community Health Worker Association was formed to give CHWs a network or a space to advocate, network, collaborate, and to grow together. You can go ahead and change the slide. So this slide here dictates our timeline on what occurred. So as you can tell, the association efforts really started back in 2002 when Napualani Spock, the seasoned CHW, was hired by Hawai'i Primary Care Association to start our first advisory committee. Took some time to get the ball rolling, but in 2006, a statewide meeting on Maui with professionals from the national level occurred. And in 2015, CHW and CHW allies gathered at Kapiolani Community College to continue the support of the training and the curriculum. 2017, a professional we renewed efforts to organize CHWs and address professional development issues at a CHW conference. And from here, the ball really rolls out where different core CHWs gather with their partners to start planning sessions and groundwork to establish this association. And in 2019, we held a conference with discussions on creating the statewide association. And 2020, we launched our needs assessments. In 2021, the association formalized at the November Summit Leadership Council. Nominations began and subcommittees began. And 2022, we are now a full-blown council association with a full-blown leadership council that was developed this year. And we also responded to SB 2882, which was a CHW certification bill. Because the certification bill didn't really address all needs of CHWs and really didn't get the input from all CHWs, it was eventually deferred. And in this year, we hosted our first Growing in Strength CHW conference and conducted 2 strategic planning meetings. 2023 regional meetings conducted on each island. So we went to each island and met with CHWs there. And we started our CHW sustainability project and hired our first coordinator. Now, here we are in 2024, not just working on local efforts, but also partnering with NASHWA, the National Association of Community Health Workers and Partners in Health, on national efforts, and supported them with our second annual Capitol Hill visit. And we also attended our CHW Sustainability Summit. But I do want to pause and really reflect back to look at how long it took, right? How many partners we brought together and how much different input that we needed to really move forward with our association. So it wasn't something that was a rushed process. It was something that really took time, and it was very crucial for us to get input from all CHWs to make sure this is what the CHWs wanted within the state of Hawaii. Something that we pride ourselves on within the association, and that is 100% CHW driven. With Gracie's expertise and myself as the coordinator, we really understand the barriers, right, and the struggles that CHWs have here in the state of Hawaii. And our goal is really to help advance the CHW workforce here within the state of Hawaii. But I'd like to acknowledge all the partners, all the allies, and all the CHWs that contributed to this effort. You can go ahead and advance the slide. So here we are now, 2024, with a full-blown leadership council. Of course, you've already met our chair, but our outgoing chair, I do want to make mention, is Claudia Hart, circled in purple. She is also on the board, a board of director for the National Association of Community Health Workers. And then we also have island representation. As each island is very diverse, it's important that we understand its diversity and its barriers on each island. And if you look at our leadership council, we pride ourselves on having a very diverse leadership council, diverse in geography, culture, ethnicity, language. And that diversity really helps steer our association to make sure all needs of CHWs employed in all different work sectors are taken care of. Our mission at our CHW Association is to empower and equip community health workers to reduce health disparities by increasing access to training, education, and multi-sector collaboration. And we envision community health workers recognized as integral partners to creating lasting change to healthier communities in Hawaii. Please advance the slide. One of our biggest goals is to really raise awareness around the workforce and who we are and what we do. So we developed this informational sheet and launched it at opening session over there at their state capitol in Honolulu. We're able to meet with over 21 legislators and able to speak on the workforce and how we're improving their communities and working with their constituents. So this informational sheet will go over who we are, kind of what we do within our scope, different titles that we fall under, and how we're really highlighted during COVID-19 as well as the Maui fire response, and also gave opportunities for legislators to touch bases with the association to talk more about community health workers and how we can impact their communities. You can go ahead and change the slide. Awesome. So what do we provide for CHWs besides an association? So within the association, we have monthly CHW only meetings. And this is really to provide CHWs a safe space to get to know each other, to network, right? To learn and to grow together. Our CHW only meetings are ran by our CHW Leadership Council. We also bring on different speakers from different resources where CHWs can learn more about the resources available to them and their community members. We'll also give some updates in regards to the movement of the association and the updates in regards to the different committees that are happening. But this is really a great space where it's CHWs only, and it really is CHW only. There's no CHW supervisor there, no managers, no allies, and we really wanted to provide a space where CHWs can openly talk about some of the barriers and challenges that's happening within the workforce. So these meetings happen once a month. I'm going to change the slide, please. Within the association, we also have our website, highchw.org, and this is really a hub for our community health workers. It provides a space for different resources where CHW can look up resources that they need, such as navigating Hawaii's legislative process, such as COVID-19 and the critical roles. CHWs can upload resources available through their organizations so that other CHWs have access to that, or they can look for resources that they need for their community members. We also provide a page for different events that are happening within the association. So CHWs can log in and see where we're at with our CHW only meetings, our different committee meetings that's happening, our different lunch and learns, and also a space where CHWs can upload events from their organization so that other CHWs have access to it. Go ahead and change the slide. Like I mentioned, our website is that community health worker hub. So we also provide a space for employment opportunities where CHWs can go ahead and look for employment opportunities of their choice, or people that are exiting the community colleges can go ahead and look up. And also where employers can go ahead and seek the best fit for their organization by posting their employment opportunities here. And then of course, we offer a space for training and services. You can go ahead and change the slide. We provide monthly lunch and learns for our CHWs. So each month we'll have a different topic. CHWs can go ahead and log into this page to see which lunch and learn is coming up. They can either go ahead and register for an upcoming webinar, or even register for a previous webinar that has been pre-recorded. These lunch and learns come from the request of the CHWs, not something that me and Gracie or allies come up with. Is pertinent resources and training that CHWs are seeing within their communities. So we'll launch a poll, and according to those polls, we'll go ahead and take that back to our Leadership Council Workforce Development, and we'll go ahead and put together our lunch and learns. But these are available once a month and also ongoing through our website. You can go ahead and change the slide. So at this time, I'd like to go ahead and turn it over to our associate Rosie to talk a little bit more about the association and the Hawai'i Public Health Institute. Mahalo.
Awesome. Mahalo, Chauncey, and mahalo, Gracie, for all the great work you both do as community health workers. Aloha mai. My name is Rosie Philemoni, as Carmen mentioned. I am the statewide program manager, community health worker liaison at the Hawai'i Public Health Institute. And similar to Chauncey and Gracie, I am also on Hawaii Island, born and raised in the district of Puna, where we are known to have our lavish rainforests and fields of lava rocks in our backyard. And really, it is a true honor to be here in the space with you all and share a little bit more about the role our Hawai'i Public Health Institute plays to support our CHWs throughout the state of Hawaii. I myself, I am a CHW as defined by the National Community Health Worker Association. Allies are non-CHWs who work across many sectors in authentic partnership with CHWs and can include program managers, researchers, employers, advocates, providers, and so forth. And really, I am just here to support the CHWs as they grow their workforce. And just a little more about Hawai'i Public Health Institute, also known as HiFi. We are the Public Health Institute for the state of Hawaii. We are a statewide nonprofit that began in 1996, where we were actually formerly known as the Coalition for Tobacco-Free Hawaii. Then around 2012, we switched from that singular focus to a broader public health mission. And currently our mission is to advance the health and wellness of the people and the islands of Hawaii. Next slide, please. So as mentioned, I oversee our community health worker initiatives here at HiFi, and we are an ally organization to the CHWs and have been supporting the CHWs throughout the state since around 2017. And of course, we'd like to acknowledge the amazing work that has been completed by CHWs and other partners, as Chauncey mentioned in the association timeline, and all the work even before the 2000s. I know CHWs have existed for a very long time. But we hear some of the support that we provide and continue to provide include assisting the growing of a grassroots association, as Chauncey mentioned, which as of 2022 is now a full association. We are honored to be working with the CDC and our Hawaii State Department of Health on the 2109 CCR project, also known as the COVID Response and Resilient Communities Project. And we also assist with the CHWs in finding pathways to sustain the amazing work that they do. Most importantly, I think we also convene our allies within Hawaii so that we can learn more, advocate for, and really support our CHWs out there. And I'll kind of go into more detail regarding each item in the upcoming slides. So next slide, please. So starting off, just wanting to share a little bit more about our work with the 2109 CCR project. The overall goal for this project is to really highlight the integral roles that CHWs play in increasing resilience and response efforts in our hardest hit communities. And we're able to do this through 3 high-level strategies, which include training, deploying, and engaging CHWs throughout their communities. And as Chauncey mentioned earlier, the Hawai'i Community Health Worker Association does conduct trainings for CHWs that we refer to as our lunch and learn trainings. These trainings were developed for an hour lunch period because we've learned that CHWs, this might be all the time that they have, that they're provided to attend these trainings that they're looking for. We've also learned that some employers, not all, but some employers don't necessarily allow CHWs the time to really dive into these trainings and enhance their skill set in this way. And many reasons to this. I think some of it is partially due to just the lack of knowledge on how to support the CHWs that they have, or the lack of understanding, right, what the full scope is. So what kind of trainings do they need? And we've also heard too, just the demand for CHWs. I mean, look at all the great work that Chauncey and Gracie do, and having to give up a CHW for a day to attend a full training or conference. It's not it's where some areas that employers are having a hard time to sacrifice, right? But these are just some things that we've heard, and we, through, like Chauncey was mentioning, our educational campaign, we're trying to really increase the knowledge of what CHWs are, their scope, and how others, non-CHWs, can support their CHWs that they're working with. So again, by developing these hour lunch and learns, we really allow a space for CHWs to grow in their field during this short period of time. And these sessions are also recorded and sent out to CHWs that they can review at a later time when they do have the time to invest in themselves. These trainings are also free, as mentioned, to CHWs, are developed by CHWs for CHWs. And actually, the demand has been so high that they were actually supposed to be quarterly trainings, but because of the demand, we transitioned it over to monthly trainings for CHWs. And really the reason why it is online lunch and learns is because we are trying to reach that CHWs throughout the state. However, if there are specific trainings that CHW programs within specific organizations are looking for, we do coordinate those in-person trainings and provide those trainings at the organizations. And then in addition to that, trainings that we do provide in person are also provided at our largest gatherings for CHWs in our state, which is the Hawai'i Community Health Worker Conference, as well as our regional meetings where we go to each island and meet with CHW on each island. Travel is difficult. We're all separated by water, so it might be easier for us to bring the training to them than for others, neighboring island, to come in and receive those trainings. For the deployment strategy and an innovative approach, we have identified partnering organizations that maybe didn't have a CHW within their organization, or had a CHW but potentially lost it due to funding, where we could just really include a CHW and a bilingual health aide to enhance the services that the organization was already providing in relation to addressing COVID-19 and other chronic diseases. We are really happy to be able to place CHWs and bilingual health aides in settings that we here in Hawaii haven't seen a lot of CHWs in, specifically in our public housing sectors, pharmacies, coalitions, and faith-based organizations. And just wanting to highlight our work with our CHW that is deployed out to the public housing units. We are fortunate to have trained that CHW who is living in the public housing units, and that makes them able to outreach to other families living there. And that being the trusted source that they can then connect those residents to the services of the local community health facilities within their area. We've also found that many Pacific Islanders that migrated over to Hawaii, specifically from Micronesia, are the vast majority of residents that live in our public housing sector, specifically here in Hilo. And fortunately, our CHWs and bilingual health aides that are deployed there can translate and work really well with those residents. So that's really key to have in making those connections and reconnecting those residents to the services that they might be too shy to reach out for. And then just highlighting that last high-level strategy, being engaging CHWs. We continue to work with our CHWs so that they can continue their engagement and connect with community members, and provide them with the resources that they are in need of. Next slide, please. Another piece that we here at Hi-Fi has been assisting the CHW workforce with is related to the pathways for sustainability. We are on a long journey, similar to other states, to find sustainable solution for CHW, for our CHW workforce here in Hawaii. It is really important for us to support our CHWs in identifying these pathways, because as mentioned by our CHWs on this panel, CHWs throughout the state of Hawaii are being paid so little for the amazing work that they're doing. And this is especially difficult because we live right in one of the most expensive states, to where we're seeing our community members, our residents, our workforce, born and raised here, leaving the state just so they can afford to live. So not only do we want to find a way to sustain livable wages for CHWs, we want to find pathways to pay them a thriving wage so they can stay here and raise their ohana here in Hawaii for generations to come. I'm really happy to share that in partnership with our consultants, our CHWs, and other stakeholders, we are able to complete that research on what sustainability pathways in Hawaii would really look like and the actions needed to implement these pathways. So right now, CHWs, the pathway is not set to reimburse CHWs through Medicaid. As mentioned earlier, we don't have a certificate set for CHWs either. So this is why the research was really important to conduct first and foremost. And then through that research, we were able to identify the key stakeholders that would be needed, what would have to be adjusted and implemented in order for CHWs to get their services reimbursed through Medicaid. Also looking at other options outside of Medicaid, like using hubs to utilize braided funding sources to sustain CHW work. In addition to that, in addition to the research, we were fortunate to participate in national efforts as well through the Community of Transformation hosted by Envision via the 2109 CCR project. And this has been such a great space to be a part of as we continue to share and really learn from the successes and challenges of what other states are going through. And through that, we're able to bring that back to the CHW group, the association, and other CHW networks throughout Hawaii, and really provide that education and reporting all the findings back to the CHWs, identifying the pros and cons to implementing factors needed to sustain their workforce. Through everything, we just really seen the need for that education piece. We found that not a lot of CHWs understand what each pathway means and how it would really impact their work. So by providing this education and reporting back to the larger group of CHWs, it it was able to open up the doors of more discussion and addressing more questions, and even leading to more research, because we don't want to make any decisions that will harm CHWs. So again, this might take some time, but it'll be worth it. And this way, CHWs are well equipped to identify and outline the next steps to sustainability. Next slide, please. And as I mentioned earlier, we convene additional supportive allies to assist the CHWs. This group of diverse allies represent about 15 or so different organizations, including our academia institutes throughout Hawaii, insurance companies, the Native Hawaiian healthcare systems, community clinics, Department of Health, and really so much more. We do meet on a quarterly basis, and we gather the allies' subject matter expertise to assist the CHWs. And this is really the point I want to make, that we here as allies, we're here to support. We do not drive the decisions, right? We don't make those final decisions. We just come in to provide that perspective and that subject matter expertise, that input to help CHWs to make that decision on behalf of their workforce. In the end, whatever decisions are being made will impact the CHWs and impact the way they're able to serve their communities. So with that in mind, we need to ensure that decisions about CHWs are being made by CHWs and their profession. We understand, we've spoke with a lot of CHWs, and we still continue to hear it to this day, is that CHWs don't necessarily get into the CHW role to do this type of work, right? That whole sustainability piece, the policy piece. They get into the profession because they love their communities. They want to serve. They want to assist their communities. So that's why it's also key to have a group of allies to join and support in these specific areas. And we as allies can provide that training and help CHWs better understand how to navigate through policies, how to introduce new things, and how to move forward with sustainability efforts in the long run. But I really can't express enough how grateful we are for our allies in supporting our CHW movement here in Hawaii. And just one quick story I want to share is also relating to the recent fires we've had throughout Maui, and how Maui community health workers really jumped into action to address the call for help during this time. I remember the Hawai'i Community Health Worker Association connected with Maui community health workers immediately after we returned from the NACHWA 2022 Unity Conference last August. It was really amazing to see a hub like the association provide a space for Maui CHWs to really express what they were going through at that time. I remember the stories that for a lot of the CHWs there, it was difficult for them to contact their clients. A lot of the telephone lines were down, having to care for those community members still, having to just do their job while still not sure if their family in Lahaina was safe. So it really turned into a space where we just cried, and CHWs reached into support from other CHWs throughout the state. And it was really amazing to see the association really brainstorm and try to find ways to help and assist our Maui CHWs. And one of the needs that were put out by our Maui CHW, who is actually our association's Maui Island representative, Ashley Tone with Hui no Ke'olopono, she was asking if anyone really just wanted to join her and her team, and they just began canvassing Lahaina once the fires were out. And it just became a thing that it was, we're going to go out, meet at this place at this time if you're ready to go, and just basically calling out for other CHWs and organizations to assist. So what the association did, they've developed a sign-up sheet just to help Ashley get some contact information and who's coming. We've had folks fly in from the neighboring islands like Lanai to assist their CHWs on Maui, all from different entities. And we've seen, similar to what we've seen in COVID-19, that some were just signing up on their own time. We're taking PTO and going out to help. And by sharing this form, it was shared through the association listserv. And one of our amazing allies, Greg Kashaba from the Department of Health, caught a glimpse of the efforts that were being implemented, and had some funds available to offer. And so that really supported Ashley and her team and their organization to really safely enter into what now turned into such a hazardous environment. No one was really expecting that, but now they have the funds to get the proper equipment to go in and be safe. So we're really grateful that we have that relationship, and the association can be a hub where allies can really stay up to date with what's happening with CHWs and provide that support when it's needed. Next slide, please. Thank you. And this is really where this conversation leads us to today. We just want to put out a call to action. Chauncey, Gracie, and I, we really want to encourage the CHWs out there. I know there are a lot on the call through the polls, but really understand your value. Understand that your lived experience is what makes you qualified. We've seen and heard it so many times before that CHWs don't feel comfortable to be at the same table with other health professionals, like maybe doctors or whoever it might be. But know that that's your space to be in. You are involved with these community members. You made the connections like no other profession can make with these community members, and that really equips you to be at that table. Also, advocate for your positions and the impact that you have on your communities. I've heard stories through other states where funding had ended, and CHWs just really had to step up and just advocate for their role, the impact that they're having on their communities, and were able to get full-time and permanent employment in entities like their local Department of Health in other states. So really understand that your voice is powerful to make these changes. And then, of course, lastly, for our CHWs out there, lead the movement, right? Community members put their trust in you to help them navigate the many barriers that they face relating to their own health. So put that same trust in yourself and lead. Be confident in yourself to want to make these changes, to find those sustainable pathways, to advocate for your professions, so you folks can get paid for the amazing work that you guys do. Don't let other professions out there make the decisions for you. We've seen from other states, other professionals leading the efforts for CHW certification, not coming from CHWs. That's the fear that we have here in Hawaii, and that's why the association was created, to ensure that whatever decisions are being made by CHWs are being made by CHWs. And then, of course, for others out there like me, other organizations that are allies, employers, educators of CHWs, continue to partner with them, right? You play a key role in all of this too. Find your local CHW association, your networks, and so forth. Include them in that decision-making process. Don't just invite them to the table, include them in that decision making. Our CHWs out there, they're the ones that really know their communities. They have been in the communities themselves. They know the barriers, and they can help you address the barriers as well that you're trying to address within your communities. And really continue to support and invest in CHWs. For employers, provide that space for CHWs to grow and have them participate in, if it's continuing education classes or trainings, to enhance their skill set. And if you don't know, that's okay. Reach out to those networks, right? Try to understand more how you can support your CHWs. And as we've seen with our own allies here in Hawaii, the support for CHWs is needed. Funding is needed, especially during a time of crisis. Allies out there may have access to these resources that CHWs don't have access to, or they're not just focusing on because they're so on the boots deep in their communities. So this is why this relationship is key, so that allies can help and continue to support our CHWs out there. Next slide, please. And with that said, I'd like to send out a big mahalo nui loa to our Community Health Worker Association, our hardworking CHWs out there, and our amazing allies throughout Hawaii. We have the privilege to be working with you folks, and it has been such an amazing journey. And of course, to PHI and all that assisted us with this month's Dialogue for Health. And lastly, mahalo to you all for attending today's presentation. We are honored to share this information with you all. Mahalo.
So I almost don't know how to begin the next level of conversation, but y'all did such a phenomenal job of presenting, painting a picture of how complex your work is and how many places, how many people, how many situations that you touch, and that you really help people move and get on with their lives and improve their health. So I'm going to go ahead and try to figure out how to organize the questions. I know that you have answered parts of them, each of you, but I think that probably in several of the questions that we can revisit the questions a little bit, and maybe expand on the answers a touch. One of the things that was made as a comment was that community health outreach workers had already existed in addressing HIV epidemic in the 80s and the 90s. And I thought that was a really important point to bring up. And also keeping in mind that in the 60s and the 70s, the women's health movement that was really, really pushed by women who were outside of any of the traditional structures, did amazing work to really help define what women's health needed to be. And I think part of what we see here is that when you have people in the field who are experiencing the issues, who are experiencing the health crisis, who are really engaged in their lives, and who live outside of a traditional health care system, that they have and they use and they organize around the knowledge that they do have. And that's what I think is so amazing about women's health movement, the community health outreach workers during HIV/AIDS, the work of community health workers in general, is how many ways in which you change and influence the environment in which health can happen. And it's just such an incredibly important thing to recognize and to sort of start out as a fundamental for this set of interaction with our listening audience. I kind of like to go back for a moment and ask you to really, each of you, to maybe talk a little bit, not just about the fires, but also about some of the other crises that have impacted people's health, like COVID, like what happens when there is a hurricane, what happens when natural disasters and things that are mass events. Talk a little bit, each of you, about how community health workers have played a really essential part in helping people to find their place and get on with their lives, and ways in which other parts of the healthcare system can't do.
Thank you, Carmen, for that question. And I think it's very special. We're all on the Big Island, myself, Chauncey, and Rosie. And so I think that we have a very, very unique island. We experience lava here, hurricanes, tsunamis. We've had tsunamis in the past, big ones that's wiped out communities. And we have like I said, we have a very unique community here, very tight-knit community. We depend on our community members and organizations and services. Without the partnerships that we have, we wouldn't be able to mobilize some of the efforts in our communities. And that's really where it makes us really unique, is, we have been doing this since we were kids. We've experienced natural disasters while we were growing up, and it was just like a natural thing for us. I remember as a child surviving a few hurricanes and, waking up in the next morning and looking at our community in disarray. But if you wait a couple days, you'll see that the community comes together, and we start to mobilize. And so a lot of us been doing this for a long time since we were children. And so same with the Maui fire, same with, we had our eruptions here on the Big Island, which was really, um, it really took out a special place on the parts of Puna, that was really hard to watch. But, we went through that healing process together. We have a very, like I said, I keep saying this, we have a very unique relationship with our community members. We care about our people, and we make sure everyone is taken care of as much as possible.
Thank you, Gracie, so much for sharing. Absolutely true what Gracie said. Here in the state of Hawaii, we have a very unique culture where everyone is closely connected in somehow, some shape, some form. So whenever there's a natural disaster, a pandemic, community definitely comes together. But oftentimes our community members will need community health workers to kind of handhold them to the resources that they need, right? A lot of our people with the 2018 volcano eruption with Fissure 8 over in Puna, lost a lot of their homes. A lot of them lost their jobs, right? Lost their transportation. So there's definitely lots of disparities that were occurring. Having that trusted person in the community, that community health worker that's familiar with the families, familiar with the community, is very helpful versus an outsider, coming in to present resources. So first of all, having that trusted member of the community is very crucial for these people to even accept the resources or accept even hearing about it. As you can imagine, there's so much emotions going on. Having that familiar face really makes a big difference. And not just offering resources, first asking, how are you doing? It's never about that writing reflex that we all have. Here's a resource, go and get it. There's the problem. But it's really getting to know the community, on a face-to-face basis, not just over a phone call, but getting boots on the ground, knocking on those doors if there's a door left, right? Finding those community members and asking them, compassionately, how they're doing, and what can we help you with, right? And if they accept the help, offer them those resources. A lot of our community members will stop just at that phone call. We will give them the number. They'll stop if they don't get that phone call through. So a lot of our community members require the hand-holding. And of course, our goal is to build their capacity where they're self-sufficient in regards to navigating to the social services or medical care that they need. But the Native Hawaiian population especially really requires that hand-holding, making sure you hold them over to the next that referral source. Not just them, but make sure you communicate between these different referral sources. Lots of resources out there, but hardly anyone's communicating with one another. So community health worker is really there to help, bridge those gaps and communicate, to the member, to the community member, as well as to the referral source, and watching that whole process start until finish, until the member, the community member actually receives the services that they need. So that's how I can explain, CHWs being very crucial during those times.
That's really helpful. Rosie, is there anything you want to add to that?
Yeah, just very little. I want to elaborate on what Chauncey and Gracie were sharing too. What we've seen with our CHWs that were through the 2109 project deployed out to the Maui fires. Just that listening session, just for CHWs to be that listening ear. No one really takes the time to do that, as Chauncey and Gracie have mentioned. And just like a parent can comfort a child that is crying, who is comforting our community members that have gone through things like the Maui fires or the 2018 eruption, who's just spending that time to just listen to them, to let them cry. And that's one of the stories I hear repeatedly that our CHWs are able to do, and just spend that time with those going through these tragic events, and then connecting them with much more than the basic needs, right? That everything that they've lost, people from even the 2018 eruption and the fires lost everything. Right. So it's, where do you even start? And sometimes it's just starting with just listening, allowing them to cry, hearing their story, and then going from there, and then following up with that. I think that's the CHWs make this connection, not just for the moment, but for the long run, and hearing their stories and how they're doing, just checking up. How you doing, Auntie? What can I help you with today? And how's the family? And it just becomes like a family, ohana, from there. Yeah.
Okay, that's really helpful. I think you painted a really good picture of what the actual work looks like during a time of crisis. I'm going to ask now a little bit about the training and preparation for becoming a community health worker. And I think there were some, it comes from a lot of different places, but if you would talk a little bit about what community college, what roles do community colleges play, and what roles do other kinds of training processes play in making sure that people who are wanting to be community health workers can have and develop and practice a set of skills that are really the set of skills that are needed at that time.
Yeah, I think I can start with some, and then I'm sure Gracie and Chauncey can add. I know in the timeline that Chauncey shared, a lot of the curriculum that was developed for the uh, certificate of competence, and I make sure I say that correctly because it's not a certification, right? Here in Hawaii, we have the certificate of competence through a couple of our community colleges. But if you look at that timeline, CHWs have partnered with other allies and the community college to really develop a curriculum for CHWs. I think since then, there's a lot we've learned, and I think there's a lot to maybe enhance and then maybe even broaden, right? If we're looking at trying to get CHWs reimbursed as well. But it all happens there, all the connection, like we've seen in the timeline, just working together. But again, ensuring that CHWs have their place and are leading that training efforts too. And then I think with that, we've heard so many, I think a lot of the ongoing feedback is that a lot of the courses are provided online, even similar to the lunch and learn trainings that are provided for us. Our CHWs, our kupuna, our super aunties, super uncles might not be well versed on how to turn on their computer and get there. So that is where the association tries to really work and travel to like the regional meetings, as I mentioned, going to each of the different islands to provide any additional trainings that might be needed. But right now, that's what we have to help enhance the CHWs. It's not anything required for CHWs here in Hawaii, but to just help them enhance their skill set. And I know there's obviously a lot more work to come, especially if other pathways are introduced for us here in Hawaii.
Yeah, thank you, Rosie. And so I myself, and I know also Chauncey, we both graduated with our certificate of competence. I from Kapiolani Community College and from Maui Community College with Chauncey, which is an awesome course for anyone to take. And I actually recommend some of our other healthcare professionals take it just for their awareness of, especially for being culturally competent when working with our community members. And like I said, that is one of the biggest things that CHWs possess is having that competence so that they can increase the health outcomes, positive health outcomes for our community members. But most recently, I have heard that we do have CHW programs embedded into early colleges in high schools. And I know one was on Oahu, I think it was Waipahu High School, where students are graduating with their certificate, with their high school diploma. And so they're already getting a head start on what community health workers do. And, they're already equipped for the field after high school. So that's another pathway for training for our future CHWs. We were fortunate to, I was fortunate to take advantage of some of the grant funding that was provided for free courses through Kapiolani Community College, and they still provide those courses through grant funding where we don't have to pay for the tuition, but we still have to show up. So that it does take some of our time and sacrifice, especially if you're working and you have a family.
Awesome, Gracie. Thank you so much for sharing, and also for Rosie. I know KCC is actually in the midst of launching a new cohort that's coming up starting in August, I believe, and they'll be partnering with Waianae Coast Comprehensive and providing that curriculum there on site. But for CHWs who are interested, or community members who are interested in joining the CHW workforce, I feel that all it requires is a heart for your community. A lot of our CHWs, with the lived experience they have, whether they lost their housing, right, whether they lost their families, whether they were addicted to drugs, or maybe justice involved, we find that these lived experiences really outweigh any curriculum that come our way. And because of that lived experience, we know we can relate and we can navigate them to the solutions that they need. So I always encourage, community members, don't be intimidated by the workforce, but as long as you have that heart for the community, you're a community health worker and you'll thrive as long as you have a heart for your and passion for your community.
Really, really, really good perspectives. Thank you for that. Let me ask you, I want to ask one more question about the system, and then I want to get into the association a little bit. So what different places are there for employment? So local health departments, health plans, other kinds of organizations, so that people who are part of the audience can understand where, who they might be working with or where they might seek employment.
It's very extensive. I think we have community health workers working a lot of places that they probably don't think they are a community health worker. And so I think that's one of the barriers of identifying who can be a part of our association, because they may not identify or might not think they are, but are a community health worker. But some that come to mind, like our homeless outreach workers. We have community health workers that I heard that are integrated into high schools now, that are doing outreach to families. So that might be another setting. And also our justice involved community members might have CHWs within the jail systems to follow their clients after they are released, to make sure that they're getting services after they get released. So those are like the more non-traditional settings for CHWs, but they are everywhere. If you look well enough, you'll see someone supporting someone in our community. And for me, that is a community health worker. Some community health workers don't even work for an organization. They're just out there helping families. And I think that is just the culture here. It's Hawaii. The aloha spirit is real. We just have a heart for taking care of people. If you see an auntie on the side of the road and she's walking and she has some groceries, it's just natural for us to go there and help. Hey, auntie, do you need some help? And I think that's what makes Hawaii so unique. And because we're so isolated, we have to malama each other, or take care of each other. And so I think naturally we all kind of have that heart for this field, even if you don't know it, if that makes sense.
Okay, I'm gonna go into an area. I want to end with the association talking about the activities that you have planned, but I also want to get your thoughts on what I think is an area of very active conversation, which is what about credentialing? What about certifications? What about not certifications? What are your thoughts about that?
Maybe Chauncey, you want to share with them, since you went over that in your slide deck? It is a big conversation, like you said.
Sure. So right now we currently launched our CHW sustainability project, right? So first of all, it was kind of taking in all this data, taking a look at the next steps for the state of Hawaii to bring that sustainability piece. And we're finding that it's not one revenue that'll bring in that sustainability, but it's looking to Medicaid, Medicare, reimbursement, and then braiding all of these funds together. So currently right now, in regards to certification, we're really just looking out for what the CHWs here in Hawaii want, getting a really good understanding of what the standpoint, what the perspective is with all CHWs in all different places of employment, whether you're that OG super auntie, right, that might not be able to go back to college, right, or access that computer, or maybe you're that young buck CHW that really wants to get out there, really wants to go into those reimbursement. But for our goal is to make sure that this is CHW driven, and the direction that we go is what CHWs want to go in that direction. So right now we're currently in the process of gathering, the thoughts of our CHWs. We also participated in a sustainability summit over in Spokane, Washington, Mastermind, where we got to meet with national leaders and with different associations from different states to see how they started their certification process. Of course, each state is different, right? And each state will come up with their own process. So right now, we're just in the midst of bringing back all of this information and education that we've learned, sharing with our CHW statewide in the state of Hawaii, and then gathering some feedback from them. But I know our CHW Leadership Council within the association is actively engaged with this process and making sure that we're engaging with all CHWs, even those that aren't quite connected with the association yet. So I think it's just starting off with conversations at this point and gathering information.
And I do like to add, in 2022, there was legislation that was introduced in terms of CHW certification. And I think it was introduced by maybe one individual or limited perspective. And I think, and that was one of the first legislative pieces that the association really provided testimony on behalf of, just because there was a lot of other CHWs that were really left out of that. So I think that's kind of like, if we have CHWs that are volunteers, right? So we want to ensure anything that moves forward with the certification piece. I think one of the biggest things is that with certification, what are the dues going to look like? Already CHWs aren't getting paid enough or that much. And so we can't tack on a certification due as well that they can't afford. Then we'll just lose the workforce altogether. So I think that too, instead of being rash and trying to introduce something just because we might think we need it or it's good or beneficial for some CHWs, we want to ensure that whatever is introduced, whatever standards are set, don't affect the other CHWs that we might not be seeing, the volunteers, the ones working for the smaller CBOs, the nonprofits. So that's why this whole discussion is really key. And yes, it might be taking a while, but these discussions are really important to have in this time to marinate, to understand and educate CHWs of, if we do introduce this, what is the impact, is really key, so that more CHWs can build their knowledge on it and more CHWs can be involved in that decision making. Leadership Council is really great in bringing together those CHW voices. We have the island reps representing the different islands. So ensuring that all the communities are well represented in these decisions being made forward.
Really, really good points there. Talk a little bit about, we just have a couple of minutes left, but I want you to talk a little bit about the association and the activities the association has planned, so that people who are listening can see if there's any way to participate or any way in which they can stimulate some similar activities in their own states.
Well, yes, we are gearing up for our statewide conference. It's coming up in August. And so it's always nice to gather your CHWs in one place and celebrate them. And that's what we plan to do in August. We also in the process of developing a CHW proclamation to honor our CHWs. To hopefully we'll have our governor, Josh Green, sign off on it, and we will introduce it at our conference. And we'll honor August as CHW Awareness Month. And so that's another initiative that we're trying to finalize. In the past, like Chauncey presented, we've visited our legislators at our Capitol Hill, or actually our local state senators and representatives, and also our national Congress women and men in DC. So we do a lot of policy advocacy with CHW sustainability, specifically for the national level. We advocated for the CHW Access Act in Washington, DC. And so that's something that any CHW anywhere in America can get involved in and find out more information about. We have a advisory CHW or policy advisory group that meets every 2 weeks. This is on a national level. And it's really a great place to learn about what other advocates are doing nationally and locally. And so we really look up to them because they are the examples that we want to learn from. And so if you want to start small, if you have a network in your state, I would start there. and see how you can get connected and learn more about what's happening in your local area.
Anything else anyone wants to add?
Yeah, I'll just add in, I've really appreciated all these networks that we're building nationwide with other CHW associations. When we needed help and had questions on how they move forward with things, we reached out to them, and we'd like to offer the same. If you folks have questions, we here in Hawaii, we like to talk stories. We like to do it with food, but we can do it online too. But let's talk stories and we can learn from each other. And I just love to put that out there for anyone on the call.
Awesome. To learn more about the association, please do check out our website, hichw.org. You'll find all our recent information there. You can even sign up to receive our newsletters, where you can keep up to date with all the recent activities with the association.
Okay, so let's pull up the last slide. Your feedback is so helpful to us to know what we should be talking about, what we should be bringing to you to make sure that we are understanding the kinds of issues that you're facing and really be a resource to you. I want to end by thanking our fabulous panel for the generosity of their time and the the insights that they've given us through their stories. It's really eye-opening to understand how an entirely a set of communities that are so diverse and so amazing, how much we don't see if we're not living there with you, how much we don't see, and how much wisdom and information and knowledge that you've given us today. So thank you again to everybody for both participating, and thank you so much to our panel.